My name is Mary White, and I am the new TRACS librarian serving the TRACS Institute. So there are three things I want to talk about in the next 4.5 minutes. One, what is TRACS? Two, how does informatics connect to TRACS? And three, what are library services that can support TRACS and informatics? So again, I'm new here, so it's really nice to get a chance to talk with you today and meet with you. What I was going to show you is something that you can absolutely find on your own, which is the TRACS website. And you can Google TRACS. Oh, yay, it's up. All right, here's the TRACS website. But there are some handouts in the corner. If you forget everything I've said, you can always grab one of these things and check out our website. So TRACS stands, the North Carolina TRACS Institute, TRACS stands for Translational and Clinical Sciences. It's one of over 60 National Institutes of Health Clinical and Translational Science Award institutes across the country. How many of you have eaten at the beach? Oh yeah. So what you might not be aware of is on the second floor above the beach, that's the home of the North Carolina TRACS Institute. And TRACS has services and resources that can serve across all of campus. So when I say I serve TRACS, I really serve you as well. What TRACS is, the mission is to accelerate clinical and translational research. But how it does this is to support the research effort from basic and lab sciences to clinical research to policy changes. So really, it's very broad across the entire research spectrum. And it offers an amazing amount of resources and services that many people aren't aware of. I'm only listing a few of them, but there's biostatistics support. If you're trying to figure out regulatory issues like IRB, they have people to help you with that. Recruitment, a wide variety of services, one of them being a librarian that can help you with things like grant support, for example. They even have people that can help you work on your grant proposals. So those are just a few of the services that they offer. The TRACS, again, it serves the whole of UNC's campus. It's not just for School of Medicine or School of Public Health. And something that TRACS wants to do, and why I think it's so important to talk with the people who are interested in informatics, for those of you who are just here for the CHIP session, and for those of you who are just interested in understanding how TRACS and librarians, HSL can work together, informatics is a very interdisciplinary field. And what TRACS wants to do also is to bring people together to conduct research. So if you're in School of Medicine, if you're in School of Public Health, if you're in SILS, if you work in social sciences, do you have an interest in health sciences research, biomedical research? We want to bring you together and help support that research using all of these resources and services. It is free to join TRACS. You can become a member here. It doesn't cost anything. It just gets you in our system so that when we're working with you, we can keep track of how we're working with you. You might say, well, you just listed all of these resources and services. I don't know who to contact. You don't have to worry about that either. You can request a consult and you'll be directed to the appropriate person. And I've also included my contact information in the back. So in the previous session, you met a lot of people from TRACS and you probably didn't realize that. There is a core in TRACS called the Biomedical Informatics Core. They mentioned the Carolina Data Warehouse for Health, which helps you search researchable data from the UNC healthcare system. They help with clinical research and data management systems, offering secure web workspaces, exploring the use of clinical information systems such as Epic. So that's just a few of the things in summary that they were talking about in the last session. So finally, as a new librarian for the TRACS Institute, I serve all the members of TRACS, the staff and the faculty of TRACS, and this can be you. The librarian can support a variety of needs across the research process. What the librarian has done in the past and some things that I've already started working with are helping people seeking out funding opportunities. And again, this can be particularly interesting as we're bringing together people from different research communities, helping people through the literature review process, helping people find experts and resources through Reach and See, citation management, understanding NIH public access policy compliance, metrics, and more. And just in summary, I'm new to UNC, but I'm also really interested in informatics. After I finished library school here, I studied public health informatics, and I studied doctoral coursework in public health. I have a clinical background as an EMT, and I've worked with some disaster information systems. So all this stuff is really interesting to me, but I look forward to the conversation that we'll have at the end of the session about how we can better support you and how we can work together. So thank you very much.